Weak urine stream? 7 reasons you shouldn't ignore. Intro, Dero Guerrero. Have you noticed that your urine stream isn't as strong as it used to be? Maybe it takes longer to empty your bladder. Maybe you have to strain to start urinating. Or perhaps your stream is weak, stops and starts, or dribbles at the end. A weak urine stream is one of the most common urinary symptoms, especially in men over 50. While an enlarged prostate is often the cause, it's certainly not the only one. As a urologist, I'll explain the 7 most common causes of a weak urine stream, when it's nothing to worry about, and when you should see a doctor. Let's get started. What is a weak urine stream? Doro 45. A healthy urine stream should be steady, continuous, and easy to start. If your stream has become weaker over time, you notice hesitation before urine starts flowing, or it takes much longer to empty your bladder, this may indicate a problem somewhere between your bladder and the urethra. Fortunately, many of these conditions can be treated effectively. Cause number 1, enlarged prostate, BPH, 130. By far the most common cause in men over 50 is an enlarged prostate. The prostate surrounds the urethra. As it grows, it gradually squeezes the urethra, making it more difficult for urine to pass. Typical symptoms include weak stream hesitancy, stopping and starting dribbling, frequent urination, waking up at night to pee, feeling that the bladder isn't completely empty. The good news? There are many effective treatment options, ranging from medication to minimally invasive procedures and surgery. Cause number 2, urethral stricture, 245. Another important cause is a urethral stricture. This means that scar tissue narrows the urethra. It can develop after previous surgery, catheter placement infections, trauma. Unlike an enlarged prostate, this problem can occur in younger men as well. Cause number 3, bladder muscle weakness, 345. Sometimes the bladder is simply too weak to empty properly. This can happen because of aging, diabetes, nerve disorders, previous bladder overdistension. The bladder contracts, but not with enough force. As a result, the urine stream becomes weak, and urine may remain inside the bladder. Cause number 4, certain medications, 440. Some medications can make it more difficult to urinate. Examples include certain antihistamines, antidepressants, medications with anticholinergic effects. If your symptoms started after beginning a new medication, discuss it with your doctor. Never stop prescribed medication without medical advice. Cause number 5, nerve problems, 520. Urination depends on good communication between the brain, spinal cord, bladder, and sphincter muscles. Conditions such as Parkinson's disease, multiple sclerosis, spinal cord injury, diabetic nerve damage can interfere with this process and lead to a weak stream or difficulty emptying the bladder. Cause number 6, prostate cancer, 555. Many men immediately worry about prostate cancer. The good news is that prostate cancer usually does not cause urinary symptoms in its early stages. In fact, a weak urine stream is much more likely to be caused by benign prostate enlargement. However, persistent symptoms should always be evaluated by a healthcare professional. Cause are 7, constipation, 635. This one surprises many patients. A very full rectum can press against the bladder and the lower urinary tract. In some cases, severe constipation contributes to difficulty urinating and a weaker stream. Treating constipation may improve urinary symptoms. How do urologists find the cause? 710. When someone visits my clinic with a weak urine stream, I usually start with a few simple questions. For example, when did the symptoms begin? Did they develop gradually or suddenly? Do you wake up at night? Do you strain to urinate? Do you feel that your bladder empties completely? Depending on your symptoms, your evaluation may include a urine test, ultrasound measurement of residual urine, uroflowmetry, which measures the strength of your urine stream, and sometimes cystoscopy or urodynamic testing. In most cases, the diagnosis can be made without complicated procedures. What can you do? 815. If your symptoms are mild, these tips may help. Don't ignore persistent symptoms. Avoid waiting too long before emptying your bladder. Stay hydrated, but avoid drinking large amounts right before bedtime. Treat constipation if present. And if your symptoms are getting worse, make an appointment with a urologist. Early treatment often prevents complications such as urinary retention or bladder damage. When should you see a doctor? 9. Stricture. Seek medical attention immediately if you suddenly cannot urinate at all, have severe lower abdominal pain, notice blood in your urine, develop fever or chills, or experience severe back pain. These symptoms may require urgent treatment. Conclusion. 940. A weak urine stream is common, especially as men get older. Most cases are caused by benign conditions, such as an enlarged prostate. However, a weak stream can also be caused by urethral strictures, bladder problems, nerve disorders, or certain medications. The important thing is not to ignore persistent symptoms. The earlier the cause is identified, the easier it is to treat. If you found this video helpful, please leave a like, subscribe to the channel, and turn on notifications for more evidence-based urology videos every week. Thanks for watching, and I'll see you in the next video.